Hi, I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter,
And we're Medical Wellness. This is your place for evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
This video is really important, and we have kind of been putting off making it because we recognize that it's really difficult. We're going to be talking about risks of postpartum mental illness for mostly the child who is exposed to a parent who has mental illness, but also the person who is experiencing it as well. So a caveat.
Caveat is that we're talking about risks. So we're not saying that if somebody has postpartum depression or anxiety, that these are absolute things that will happen. We're saying that if somebody has postpartum depression or anxiety, it increases the risk, the possibility of these things happening.
I just thought of a good metaphor.
Okay.
Yeah, okay. So your risk of falling when you walk outside is like a baseline risk, right? But if there's ice on the street where you're walking, of course your risk is going to be increased. But that doesn't always mean you're going to fall.
Yeah, that's a good point.
She's been trying metaphors.
She's been trying to think of a metaphor for this.
Let's thought of a good one. Okay. So yeah, they're not 100% things that are going to have it. It just increases the risk. And having this information is really important because this is the information that we use to assess risk versus risk.
Right. So when we're deciding, hey, should mom start this medication and continue breastfeeding? What are the risks of the medication versus what are the risks of her continuing to be depressed or anxious?
Mm-hmm. Right. So we'll briefly discuss the risks for the person who is experiencing depression or anxiety in the postpartum period. And then the majority will be about the child.
Yeah. So the risk in person experiencing postpartum depression is obviously this increased risk of suicide, which we worry about a lot and is, definitely real. But we also worry about littler things like they have an increased risk of not being able to bond with their baby or feel connected to their baby. Mm-hmm. And they have an increased risk of not being able to breastfeed.
There also is an increased risk for the partner, if there is one. For the person experiencing depression, their partner has a much greater risk of experiencing depression themselves.
Yeah, so then you end up with two parents with depression.
I always tell my patient, like, you're the keystone of everything in your family. And if you're doing okay...
It's a lot of pressure.
No, I don't mean it that. I just, it's more of a way to say, like, you really matter and you taking care of yourself is really important and you deserve this to feel better.
Yeah, by taking care of yourself, you're taking care of your family.
Right.
I think that's a really important piece to remember.
Right. Okay, so we'll move on to the child, which there's a lot of information here, but these are the risks and really part of the reason that we say really take care of yourself, treat your illness if you are experiencing it, because it's not just about how it impacts you.
We're going to go through a lot of individual risks, but I think the big picture thing is that baby's brain is developing so rapidly in that first year after giving birth. And so if you think about it in that way, what does the brain do? And how that kind of helps understand how these things can be more likely to happen in a baby whose parent is going through mental illness, because mom and baby or parent and baby's connection has a lot to do with baby's brain development. There's a lot of research supporting that those, like, even little interactions and big interactions and everything in between has an impact on how baby's brain is developing, and it's really important. Mm-hmm. So the things that come from that are, changes in their emotion, their behavior, their development, both physically, mm-hmm. but also their development mentally and intelligence-wise.
Right, so things like meeting milestones on time. A child who is exposed to a parent who has mental illness in the postpartum period has an increased risk of hyperactivity, of depression and anxiety themselves, more like aggressive behavior, more antisocial type behavior.
Yeah, and that includes later on in life. These people who grow up to be adults are more likely to have aggressive and antisocial behavior.
Speaking of adulthood, like throughout their entire life, they have an increased risk of medical illness.
Mhm. Yeah, and in earlier in life, they have a increased risk of developmental delays and speech delays. And then we also see that they have decreased intelligence overall, but we're not talking like,
Intellectual disability.
yeah, we're not talking intellectual disability. We're talking like they just score a little bit lower on intelligence tests than babies who were not exposed to mental illness postpartum.
Their physical growth in that first year, right? Like they might be more underweight. They might, does height also?
Well, I think there's like the whole underweight or just not like stunted growth in general. So I'd imagine that would include height.
Okay. And then, of course, the biggest risk is that they are similar to how the person experiencing postpartum depression is at risk for suicide. The child is at risk for infanticide, which would be death by the parent. Yeah. And that is, I mean, obviously devastating. Those cases are really highlighted in the news, and we see those a lot because they're very shocking. And of course, that risk is increased if you're experiencing depression or other psychiatric illness. Yeah. Which is, I mean, it's so hard to talk about those things, but it's really important to talk about those things that we know they exist. And if we are not sharing that information, just because it's uncomfortable for us to talk about that, we're doing everyone a disservice.
Right.
Yeah.
And there are things that you can do, obviously, to help your mental health, like treatment, therapy, medications, all that good stuff. We have lots of videos on ways to improve your mental health. And then we have some videos on ways to improve your bond with your baby if you have struggled with mental illness in the past.
Yeah. So I'll be sure to include those in the notes underneath, like, what is postpartum depression? I think we have a video on ways to reduce your risk for postpartum depression. We also have tips on bonding with your baby, which if you're increasing your bond with your baby, it's likely that you're going to reduce the risk of these things occurring. So all of the information is out there for you to have it, for you to make informed decisions about your care and take care of yourself, because it really is important. And that's the whole point of this video, is take care of yourself. And we want you to have the information so that you see what can happen if you don't, what the risks are if you don't. Yeah. Thank you so much for being here. Please like, comment, subscribe, share with your friends, watch the other videos. We'll see you soon.
Bye.